First presenter is David Shannon. David is a member of the Law Society of Ontario, practicing health law in Thunder Bay. He has won numerous prestigious awards and honors, such as the Order of Ontario and the Order of Canada, for his work advancing the rights of disabled persons and other minority groups in Canada and abroad. So, David, welcome. Thank you for joining us, and I turn it over to you.
Thank you so much, Zoe. It's a pleasure to be able to share tonight with you and join Ramona and collaboration this evening. And to join many friends. I know that many friends have registered, many uh, persons here today who share in a common interest, a common uh, willingness to address this highly emotional uh, question, experience, this highly sometimes inflammatory time that has the most grave of consequences for individuals and families in Canada. But my purpose tonight is not to resurrect inflammatory stories of painful end of life suffering, but in particular, as Zoe said, I'm here to talk about how MAiD impacts disabled persons today, as as the legislation, as the policy, as the experience within Canadian culture has evolved. All too often, talking about the most extreme examples, the discussion often digresses into a political or positional, even ideological debate. That's just not productive. This is a time of great vulnerability when thinking about MAiD and talking about MAiD, and therefore this is not a strictly legal decision. Now, you've heard a little bit about my background. I just wanted to let you know that my perspective. I am a person who's lived with quadriplegia due to a spinal cord injury for over 43 years. Yes, 43 years. I certainly would have been impacted if that were today with the question of MAiD before me and by persons around me. I never had that. And as a result, 43 years later, I have a family I love, friends I love, a position in my world and community that I believe is healthy and very stable. And in addition, I am a lawyer who has practiced in the field of disability rights and mental health law for over 25 years. So, in other words, as you might infer from that, the topic of MAiD is one that is deeply personal to me, deeply personal to people I love, deeply personal to many of my deepest and closest friends. So, at the outset, I'd also like to ask everyone to accept one fact that's an all too harsh reality in Canada, and that is that disabled Canadians experience a pernicious form of human rights denial that includes poverty and unacceptable markers in the social determinants of health. That is what nearly approximately 20% of Canadians find themselves in due to a disability. Now, if we can't acknowledge that, we can't absorb it and understand it, can't empathize with it, then we're going to have a very difficult time moving forward with discussions about MAiD and its impact in our pluralist society. But I want you to think tonight about how ableism impacts Canadians and what it means in Canada. So I want to say then, central to my thesis tonight is that a human rights approach to MAiD, to future policy development, to new development in regulations in a forward looking fashion, that an unvarnished libertarian view it's just inadequate and is doomed to failure. That has been the preponderance of the discussions to date. One of just autonomy. I would, I strongly believe that a right to liberty needs to be balanced with a right to equality. And in that balance, we need to have an equality analysis for persons living with disabilities, especially in Canada, in the midst of the current broken social contract that has been visited upon Canadians with disabilities. Now, and with that, we do have to consider that 15,000 persons in Canada are expected to have received MAiD this year. 15,000. It's a number per capita that grows exponentially. So, what does that mean? We need to take a moment to discuss the eligibility criteria. Now, I want you to also consider that at 15,000 Canadians dying from due to MAiD is the equivalent of approximately 128,000 Americans dying from MAiD every single year. That doesn't happen to the south of us. But numbers like that have us pause to have to ask questions like, are safeguards safe? So with that in mind, we need to, though, back up a little bit and ask, how did we get here? Well, it's been a long debate, as all of you are aware of, a decades long, perhaps we might say a century long debate in Canada, beginning with the early 20th century. But more particularly, more recently, as a response to the Supreme Court of Canada's decision that a total ban of euthanasia in Canada was unconstitutional, Parliament did create Bill C-14. It was called an original sounding name, Bill C-14, an act to amend the criminal code and to make related amendments to other acts, i.e. medical assistance in dying. Now, we don't have the time for the larger debate, but you may want to take a moment to ponder whether a criminal code is the right place to start social engineering, to recreate health services, radically shift them, radically impact social services. Is the criminal code the right place to be doing that? It's a piece of federal legislation. However, it's making amendments that will impact jurisdiction that is the exclusive domain of the provinces. I'll leave you that to think about. Well, C-14 said many things. I will try to stay as blue sky and looking at that as possible. Now, I do have to profess to thinking of myself sometimes as a legal nerd, but I promise not to go too far into the weeds. I know that repeating the law can be a rather boring enterprise. So we do have to cover it a bit. The substantial criteria, as you will see, at a substantial level, eligibility is comprised of many factors, and this is in C-14, that the person's at least 18, they have a health card, they also must have a grievous and irremediable medical condition that has that their decision is voluntary, the request is voluntary, and in particular was not made as a result of external pressure, and it was informed consent. Many of you would know of the rules around informed consent across Canada. And everyone must be informed of alternative means that are available to relieve their suffering, including palliative care. Furthermore, the criminal code did clarify, because I'd suggest there's a lot of ambiguous language when you drill into it from a legal perspective. So they did clarify what the phrase grievous and irremediable condition meant. That is, as you will see from the slide, to have grievous and irremediable meant that the person had to have a serious and incurable illness, disease, or disability. They had to be in an advanced state of irreversible decline, and the state of decline had to cause enduring physical or psychological suffering that is intolerable and cannot be relieved under conditions that the person considers acceptable. Now, I emphasize the word person because you see it's a subjective standard, not an objective standard. In other words, the person says, that's unacceptable to me. Even if other experts, such as a medical practitioner, says, oh, yes, there's acceptable options. Also in the bill, natural death had to have become reasonably foreseeable. That was a difficult one, a reasonably foreseeable death, because that was later found to be unconstitutional. That meant the criminal code had to be amended even further to create the original title, Bill C-7. So C-14 was amended to create what's termed a two-track approach. On one hand, for those persons for whom death would be imminent, then there was now no longer a waiting list, among other changes. But for those that did not have natural death, so in other words, one could have received MAiD even if death was no longer reasonably foreseeable. But if that happened, or it happens today, they are to have a 90-day waiting period before MAiD is administered. The period could be shortened if that person, though, was about to lose their capacity to make healthcare decisions. And that would mean also, though, there has to be 2 independent assessors. That's a complicated issue about what constitutes independence with assessors, what constitutes imminent versus non-imminent death. But we can discuss that later, and certainly in the questions, because I'd suggest that clear definitions, decisions from the courts, are not there yet. Now, additionally, for a person for whom death is reasonably foreseeable, I mentioned that there's no longer a waiting period, and if a person was at risk of losing capacity to consent directly before MAiD is carried out, they can create or write an advance directive or an advance agreement. Now, the assessment of patient eligibility did not completely square with the dissenting report of recommendations made by the Special Joint Committee on Physician-Assisted Dying, because they noted palliative care should be offered and available to any person contemplating MAiD. One of the difficulties then is that a person with a 90-day wait period, with a serious disability or illness, they have potentially years to live, but they find that their own suffering is intolerable. They are supposed to be informed of options. Some would be informed of palliative care, but there is no constitutional requirement to provide them that care. In other words, the government breaks that social contract. So you're informed of palliative care, you're informed of home care, you're informed of the availability of personal support services or occupational therapy, but there is not a constitutional guarantee to give it. Sadly, there is a constitutional guarantee to give you MAiD, but not the very support services that could alleviate your suffering. You see the difficulty of trying to square that or put that square peg into a round hole. Furthermore, a weakness to this approach is that it presupposes that the very persons who are providing, the healthcare practitioners who are mandated in the criminal code to provide information about a person's support services or options available, it presupposes that they're experts in everything from disability supports to independent living, social work, psychology, palliative care. I don't believe that any one person has all of that expertise when they are providing information. But there is no constitutional or a criminal code requirement that that a multidisciplinary approach is taken to providing that information for the individual. So that would be a clear flaw. And we we also find that, and I say this as a person with a disability, that is never ever once been my experience when meeting with medical professionals that they technically, physiologically, medically know what the conduct or experience of disability is from training. But unless one has lived with a disability, have acquired a disability, have developed personal strategies on how to get around that disability, have come to understand the deep love one has with family members supporting them and helping them to elevate their lives. And unless someone knows that experience at a profoundly personal level, they just don't know it. I can't pretend to understand the full experiences of other equality seeking groups in Canada, other than my own. So therein lies a further problem in him trying to impart information. The question is, just how good is that information? Then we must ask, does a physical or mental condition make your life so unworthy that a medical professional can inject substances into your arm that kill you? Well, the answer constitutionally says yes. I leave you to contemplate, however, does ableism impact the decision? And going further to the larger discussion tonight, I want to talk about some concerns that I want to leave you with to consider. One is that the courts, the Supreme Court of Canada and human rights legislation talks about the social model of disability. It says that disability is a social construct. So that would mean then, if you take away the social barriers, since the social barriers are the very thing that causes discrimination, social barriers are the things that are inadequate, that are causing such barriers and difficulties as unemployment, lack of education, poverty. Remove those as a social construction, then you will remove the discrimination, or in other words, the inherent disability, the personal impact of disability. So if it's a social construct, then it maybe it isn't such a physiological construct. So in other words, if the law says that you cannot get or receive MAiD unless you have an irremediable condition, such as a permanent disability, then maybe remove the social conditions and one would no longer then be eligible for MAiD. That contradiction, that paradox, has not quite been answered. And we'll have to, hopefully, in further discussion, in further development of eligibility criteria, and maybe even further decisions by the courts. With respect to the term suffering, I would submit that the language is ambiguous. It is, as I indicated, it establishes subjective rather than a clear objective criteria. The broad concept of suffering. I'm not a theologian or a philosopher. I mean, I'm just a country lawyer. But I also believe the way it is written in the criminal code, that the term suffering is just too ambiguous to have the kind of legal exactitude that would give decent and correct guidance to MAiD assessors and also persons who are receiving information about MAiD. I believe that a better test would be, rather than a subjective one, it should be an objective one. That if a medical practitioner is clearly aware and it is best practices to provide a form of suffering, then it would be best to proceed with, or with a form of the alleviation of suffering. Then that would be the proper approach. There should not be MAiD in the instance of psychosocial suffering. The psychosocial suffering should be treated as a with supports, and alleviation of pain and suffering should be treated then as a medical issue or an objective and best practices perspective. I also want to touch upon a few other points for your consideration. When we look at the bigger picture of ableism and some of the factors that will be influencing information provided respecting MAiD and decision for MAiD, persons deciding about MAiD, and also persons who will be providing MAiD. I'll bring you to the United States, a recent study entitled Physicians' Perspectives of Lives with Disability and Their Life Care. It was found that of U.S. physicians nationwide, 82.4% reported that people with significant disability have a worse quality of life than non-disabled. As a person who's had a significant disability for 43 years, I don't think my quality of life is any greater or less than non-disabled people. Only 40%, 40.7% of those physicians questioned across the United States were confident about their ability to provide the same quality of care to patients with disabilities. I think you start to see how the scales might be tilting the wrong way for people with disabilities, and just 56.5% strongly agreed that they would welcome patients with disabilities into their practices. Furthermore, all empirical data on psychosocial adjustment to significant disability and or chronic illness indicates that when the opportunity to adjust through grief and appropriate psychological and social supports, individuals report that their quality of life is approximately equivalent to able-bodied persons. I know that this is a great passion and literature or expertise of Ramona, so I'll leave it for her to discuss. And if anyone though would like a very long bibliography on this topic, I'm happy to share that with you through dear friends who work in the area. Also, a recent Oxford study indicates that jurisdictions with assisted suicide across the world disproportionately impacts individuals living in poverty and especially single mothers. These are some of the larger realities of physician-assisted dying around the world and in Canada, and factors that we need to contemplate going forward. Now, I see that time doesn't allow me to go much further, but I want to leave you with a few thoughts with respect to future discussion about new regulations and where the evolution of MAiD should go, especially as it impacts people like myself, people living with disabilities, very significant disabilities. One, regulations need to revisit the definition of irremediability and suffering. The ambiguity leaves too much room for loss of life, too much room for mistakes, too much room for missing a disability lens, or in other words, too much room for the invocation of a potentially ableist lens. Future regulations, guidelines, and policy respecting MAiD need to be comprehensive. As I said, if the argument is just if the entire view is just about libertarianism or autonomy versus the absence of equality in Canada, the absence of independent living, home care, palliative care, then we won't have a balanced system. We won't have dignity and self-worth for people with disabilities in Canada. Regulation must utilize a multidisciplinary approach. Additionally, MAiD must be guarded to maintain the ethical imperative that individuals suffering a mental disorder such as depression, they should not be able to utilize MAiD as a way to facilitate suicide. That contemplation of this and proper mental health care is critical. Each province, through their own regulations and development due to their jurisdiction, should create an oversight body by way of a commission or a tribunal that can review applications for MAiD to ensure procedural safeguards and thorough assessments have been conducted. This would be an independent, arm's length body. It would not bog down the process. Many of the decisions would be very straightforward, but in those other more limited cases where there is questions, there is potential lapses in assessments, there's a potential failure of adequate oversight, there needs to be a fully independent and expert body providing a review before MAiD, because we know if there's a mistake, the outcomes are far too grave. After MAiD, you cannot go back on any errors, and it's very important to allow an individual in such grave circumstances to have a full and considered decision of the most elevated form. After all, this is Canada, and we take this so seriously in law and in our culture. And the regulated oversight body must be transparent, provide reports to government, reports to the public. Without transparency, then we will have guaranteed inadequacy.